President Barack Obama has called on Congress to come up with a health care plan that would cover the nation's 50 million uninsured Americans, a health care overhaul, if you will. Well, House Democrats say they now have a plan, and under it, the government would ensure that every person, regardless of income or health, has access to an affordable insurance plan. That legislation calls for a 5.4% tax increase on people making more than $1 million a year. Now, the House plan makes it so individuals must have insurance. Those who opt not to have it will be charged 2.5% tax on their income. Employers who don't provide coverage would also pay a penalty equal to 8% of workers' wages. Small businesses would be exempt.
Legislators from Northeast Wisconsin have different views on the $1.5 trillion plan for health insurance. Fox 11's Laura Smith has balanced coverage.
The new community clinic on Green Bay's east side sees it every day.
A lot of people who do not have insurance.
Health benefits coordinator Tony Lee supports a health care plan that would provide coverage for all.
Everybody, needs insurance because there's many people that have medical bills that have racked up and are racking up still because they do not have insurance.
A plan by House Democrats aims to help all Americans gain access to health care coverage.
The good news is that no discrimination is in the final bill that's coming forward and being amended during the next several weeks. No discrimination due to any pre-existing condition will open the doors.
However, Representative Steve Kagan says more work needs to be done.
We need to pass some legislation to help knock down the cost of pharmaceuticals at the pharmacy.
This is coming down the tracks like a big express train.
Representative Tom Petri says he's barely had time to read the 1,000-page bill, and he's scheduled to vote on it tomorrow. He says the plan does not appear to help people control health care costs.
We're not sure it's going to allow individual health care savings accounts and plans anymore. It tends to move in the direction of a more government-centered program and more top-down efforts to control costs.
Concerns about the plan are also being voiced by healthcare providers.
We are concerned about seeing the ranks of Medicaid swell.
Baycare Clinic CEO Jeffrey Mason says the healthcare plan could hurt the industry.
More people apply, become accepted, Medicaid grows, and you have a larger problem with losing money on a larger group of patients that you serve.
Mason, who was also the board chairman-elect for the Green Bay Area Chamber of Commerce, says businesses may also feel more pressure.
The economics of that will require us to pass on more of our losses from those patients to business, to commercial patients. And commercially insured patients are already paying a large amount of the freight, so it ends up being a hidden tax to business.
President Obama is pushing for both Democratic and Republican lawmakers to come up with legislation before the August break.
Hopefully everybody will be covered by insurance soon.
Laura Smith, Fox 11 News.
You can read the entire 1,000-page bill online through a link in the Newslink section on the right-hand side of our homepage.